we decided to go for lockdown of schools on 15th of March. That was a Sunday. From 16th, this was to be implemented. The first decision, along with the closing down of schools, was to let the board exam continue. And that required some persuasion at the level of government. We succeeded in that. So the best thing that happened was before the Janta lockdown on 22nd and the total lockdown on 20, from 24th, our 10th and 12th exams of the state board got completely over by 21st of March. That helped us in evaluating the answer sheets in the month of May and declaring results in the first week of June. That was a big positive move that we could achieve. In many states, even the 10th and 12th exams got disrupted because of the lockdown. We didn't let that happen in Gujarat. From the very next week, that is from the last week of March, we started home learning initiatives whereby learning content was disseminated through all leading television channels, private and government DD channels in the state. So, uh, time slots were given in advance. The learning content, which was to be covered in the last week of March and the first week of April, that was passed on to the television channels. In all major newspapers, advertisements were given for which standard, which subject, what time is allotted in which channel. So that helped in children getting the best of education through the audio visual medium. In the month of April, our usual summer vacations came. Thereafter, the big challenge was how to start the next academic year from usually it starts from June. So in the first week of June, all teachers were asked to report to school. So our schools reopened on 8th of June. Children, however, were asked not to come to school. From 8th to 15th, our teachers across the state, all government schools across the state, distributed textbooks to every student going to their home. And this was one of the greatest initiatives of its kind because our teachers went to farms, our teachers went to distant tribal clusters in the white desert in Kutch and Surennagar district. They went even up into the run and distributed textbooks. This initiative was planned without even COVID being in mind. We got every single textbook QR coded, QR coding of every learning content. So how it helped was if you have a smartphone and if you do that QR coding alignment, you would get the best of audio visual learning content available in the YouTube as well as other Government of India's Diksha channel portal, free of cost to all the children. So QR coding and distribution of textbooks, both this help children get the best of content um, in the website available to them. Now, how it helped immediately was from June in Government of India's Diksha portal, highest access to audio visual learning content across the whole country was Gujarat's. Till then, Gujarat was in 10th position, and from June to July, within 1.5 months, we just surged into the first slot because of this QR coding of textbooks and distribution of textbooks to the farthest and the most, even in the most like cities like Ahmedabad, Surat, where positive cases were in large numbers, teachers took that trouble and reached out to students and distributed. So apart from distribution of textbooks, we planned our assessments, which was to be held in midterm, that is in July. We had our first assessments for which question papers were again sent to every child in their home. Answer sheets were collected by teachers, evaluated, data entry of the answers and the answer sheets done, and all this helped in to a great extent ensuring that the uh, learning efforts actually happened. Of course, there would still be 10-15% of population who would be left out of this whole process despite all the efforts. However, even when regular schools were going on, the average attendance on a given day is only 85%. So 10-15% is even otherwise not taking up the regular schooling initiative also. Now, recently, Pratham is a very reputed national NGO in the education sector. They conduct their annual survey of education report. Every January, they come out with their report. This time during COVID, they made an extraordinary study, and a report was released last month where they said across the whole country, maximum efforts for home learning, maximum efforts for reaching out to children was made in Gujarat. And about 70 to 75% of teachers actually reached out to students, and students got the benefit of home learning because teachers made that extra effort. So uh, that's one part of COVID response. The other part of COVID response, which is equally important, is how education department and teachers responded to COVID in their capacity as frontline warriors. So across the whole state, in the month of April, when the lockdown was announced, you would be aware that government of India as well as most of the state governments came out with uh, the ration material for BPL as well as APL families. So all public distribution system, the entire PDS was activated. PDS shops were asked to distribute to ration card holders. In every PDS shop, our teachers were appointed as volunteers to support the distribution system in a seamless way. Uh, Tens of thousands of teachers uh, stood with our PDS system and supported in this initiative. And that was when the lockdown was going on. That was one when people were not aware how fatal or how intense this disease could be. Now we know that fatality rate is not so high, but at that time we were fearing that fatality rate is as high as 5 to 10%. Even at that time, teachers took that extra effort. In the month of May, June, across the major cities of Gujarat, we did door-to-door surveillance, and our teachers stood with our health team and supported in door-to-door surveillance initiatives. They also, over a period of time, mm, learned how to do simple things like using thermal guns to understand what is the uh, temperature of a person, or using the pulse oximeter, how to assess the oxygen saturation levels of a person. All these health indicators, our teachers also picked up how to assess it, and then do door-to-door surveillance along with health team. I would want to bring to your attention a unique initiative which we started in June 2020. During COVID, it's so, I mean, I personally, as Secretary Education, I was looking after all these initiatives of Education Department. However, from March, as soon as the lockdown was announced, I was appointed as the nodal officer for COVID in Vadodara city and Vadodara region, 7, 8 districts of Vadodara region, and particularly for Vadodara city. So I was very closely associated with COVID response there, along with the health team, along with the sanitation team, along with the police team, along with all stakeholders involved in the process. We came to know that one of the bottlenecks in medical management of COVID was that routinely those people who used to come and donate blood during COVID times, they were reluctant to come forward because they were fearing either their immunity would be compromised, or in the process, going to a place and donating blood would somehow lead to cross infection. The if 100 people used to donate routinely, less than 20% were now available for donation of blood. This made me think and take a unique initiative. It was a personalized initiative that I appealed to our uh, teachers' fraternity. Let's uh, come together and rise to the occasion. Let us be blood donors. In fact, teachers' fraternity is the largest fraternity in terms of numbers. 51% of government's manpower is teachers alone. So we have 2.5 lakh teachers in Gujarat, government alone. So we appealed that those teachers who are less than 50 years old, who do not have comorbidities, and who are willing to donate, may please come forward. And when we inaugurated that in Vadodara, I took the initiative. I myself volunteered to donate blood, and in my lifetime, that was the first blood donation I was personally making, and that perhaps led to a, a movement across all the districts, and more than 25,000 bottles of blood was collected in a short span of 3 to 3.5 months, so 100 days, and 25,000 teachers coming forward and donating blood. In fact, we had close to 50,000 teachers who came forward because the every single donor, his blood was checked and his parameters were checked. So close to 50% because of age, comorbidities, hemoglobin levels, and other reasons were rejected. So 25,000 units of blood was collected. I mean, this was perhaps one of its kind initiative across the whole country, where education department took up the challenge of augmenting the efforts of health department in every possible way, whether it is door-to-door surveillance, whether it is supplying, ensuring proper supply of civil supplies, whether it is in supporting blood management, whether it is in home-based supporting in home-based COVID care. The health education department, over and above its education initiatives, stood with the health department to overcome the challenge of COVID. Progress of science could not achieve in the last 10 years, COVID has achieved in the last 5 to 6 months. All the initiatives to bring in technology in education in the last 1 decade, uh, it could only achieve in a very marginal way. Even today, we have cynics and critics who believe that technology can be counterproductive for education. But even amidst all these cynics, critics, and commentators, in the last 5 months, COVID has helped in transforming education. Today, technology is not a luxury, technology is not an option, technology is a necessity in education. Today, even in the post COVID days, it's become imperative that we have to go for blended education where classroom education and technology based audio visual supported education will have to go hand in hand. Uh, the best thing about technology is you cannot make every teacher an outstanding teacher. You cannot make every school an outstanding school, but you can very much ensure that the most outstanding teacher is made available to every single student in the state using technology. The best of pedagogy, the best of learning methodology, the less best of learning content can be made available to every single student uh, using the platform of technology. So technology can become a major leveler, a major unifier in the coming days in education. Uh, Even people who thought that it will have its uh, counterproductive effects are now more or less accepting that technology can actually help in improving learning outcomes. See, many people used to comment in a very cynical way, that what is the reach of how many, what what percentage of population in India has access to smartphones, has access to televisions and other uh, IT equipment. My answer to them is so simple. Today, when government of India has liberally brought in self-employment and wage employment initiatives in such a big way, you have Mudra loans made available, Atmanirbhar loans made available for self-employment initiative, and you have scaling up of Manrega to such an extent that even an ordinary member, uh, an unskilled laborer going and enrolling himself in Manrega, ends up getting close to 200 plus on a given day. 10 to 15 days of wage employment earnings itself is sufficient to buy a simple low technology smartphone. If you can't do this much for your child, I mean, so we should come out of this mentality that only if government gives free of cost, you will provide basic requirements to your child. It doesn't go that way. Government will give you opportunities for wage employment. Government will give you opportunity for self-employment, but you have to make some savings out of it. Ensure that your child gets some mm, value added things at home. So it's easy to criticize and say mm, large portion of our population do not have access to equipments. Even that argument doesn't hold, because you can't deny education to large segment of population because small segment of population cannot afford it. I mean, that logic doesn't work. Um Merely because 100% of our population cannot afford air travel doesn't mean you have to close down all airports, or you can't wait 100% of population to afford something so that it can be made available to rest of the population. So all critics, cynics, commentators who used to downplay technology enabled education have been silenced because of COVID. And COVID has proved beyond doubt that even virtual live classrooms can be conducted even in tribal areas by our teachers. And we have successfully proved it. So what technology couldn't achieve in the last 1 decade, Corona has achieved in the last 5 months. That's the positive side of